Well, I am Dr. Adrienne Castrovinci. I'm going to be your host this evening. I'm going to be starting a presentation here shortly. And like I mentioned, that I've got Larice here kind of moderating the chat. So if there are questions or things like that, she'll be able to answer them for you. But we're going to go ahead and get started. I'm going to share my screen here. All right, so the title of tonight's presentation is Restore Your Vitality. So we're going to be discussing how to reclaim healthy digestion, how to conquer sleep challenges, and how to energize your life. Like I mentioned, my name is Dr. Adrienne Castrovinci. I'll give you guys a bit more of a formal bio here shortly. But first of all, I really just want to congratulate each and every one of you for taking the time to attend this workshop tonight. In our office, kind of in 2025, we've made this the year to invest in you. And so this is an investment. Investment of your time is huge. And you're obviously here because there's some concern that you have, or else you wouldn't be here. So we're going to hopefully do our best to address those concerns and find a solution for you as well. So thank you for being here first and foremost. All right, so really wanted to kind of look at why is it that you are here? Are you having, body struggles or life struggles, health struggles? Do you want nothing more than to feel like yourself again? Are you looking for answers to what's actually going on inside your body? You don't feel quite right. Something's wrong, right? But nobody really knows what it is. Have you tried a number of medications and treatments and are just looking for real results? That's what I see with a lot of my patients, and I'm sure some of you are experiencing that as well too. I'd like you really to kind of look inside yourself and just think about what is it that you desire. Do you want restful sleep every night? Do you want to feel energy morning, noon, and night? Are you wanting to have a dinner night out with your spouse or your friends and not to feel digestive issues afterward? Do you want to feel like you did when you were younger? Do you want a long-term solution to your health problems? So if you guys could do me a favor and just kind of write down in the chat, what is it that you're desiring? Why is it that you're here? What is it that you want to change in your life? I would love to see what those things are. I also want to start off with kind of who this is not for. So obviously making changes is not always easy and it takes time. So people who are not willing to make the necessary changes that are needed in order to improve their lives. Health and wellness is not a quick fix button, right? Health issues have taken years, if not decades, to develop. And so they don't just go away with a pill or they don't go away with a quick fix. So this is a journey. It's not a quick fix type of plan. So if this is something that you're looking for, like here's your magic bullet, here's your quick fix, this isn't the place. So I just wanted to kind of get that out there as well too. What we're going to do today is I'm going to share with you kind of what is possible if you remove the barriers that are preventing you from living your best life. We all have them though. I mean, myself included. We have fear of failure barriers, financial barriers, maybe not feeling worthy of happiness or being healthy, hopelessness that nothing's going to work. These are all barriers that you have, but I'm confident that when we address these barriers and kind of help you to manage them, address them, move from them, then you will be able to achieve your goals. So being able to reclaim that vitality that you once had and feel like yourself again. So all of this is possible. So what I'd like you to do is stick around with me until the end because we're going to be sharing a ton of information. I'm also going to talk to you how to attain a personalized and tailored solution for your health problems and health concerns. In addition, we're going to be kind of sprinkling in 3 little health insights that you can start using to improve your life today. So lots of really good information coming up. But first of all, I want to share with you kind of who I am. So my name is Adrienne, Dr. Adrienne Castrovinci. I'm a chiropractor. I have a thriving wellness family wellness practice near Minneapolis, Minnesota. Like I mentioned, my practice is here in Eden Prairie. I live in Minnetonka with my family. So I've been a chiropractor for over 20 years, which blows my mind. But yes, I've been practicing chiropractor for over 20 years. I started my practice with a sports medicine emphasis. I was an athletic trainer at the University of Minnesota while I was a student and really kind of dove into the athletic realm. I then had a couple of kids and moved into more of a pediatric and prenatal certification and that kind of emphasis with my practice, again, kind of turning into that family wellness-based population. And then in recent years, I've incorporated some functional medicine into my practice to help assist my patients with true healing from within. It's been game changing. I'm really going to talk more about that this evening. I'm also a wife and a mother of 2 young girls, ages 13 and 11, and I'm just the doer of all of the things. So I'm sure many of you on here may have families and understand that there's a lot of things, a lot of hats that you wear and you carry, and that can kind of tie into some of the health challenges as well too. So I can understand. I'm with you. So our main mission in general is to really help give the power back to the patient so that you can be an active participant in the healthcare process. We're not victims to a disease or a diagnosis or whatever. It's important to be aware of what's going on and be that active participant, because you can make true change. It's possible. I'm also striving to help change the face of healthcare by using more natural methods and lifestyle changes to really heal from the inside. As a chiropractor and natural healthcare practitioner, I've been kind of preaching this and speaking this for the last 20 some years. So it's really fun to kind of start seeing a lot of this stuff in the news now about looking at more natural based things. So I feel like tides are really starting to turn in that way. And it's also time for a different approach to healthcare. So the traditional model is what our kind of traditional healthcare practice is made of. They basically are symptom suppression. So let's use the example of a headache. For example, if you have a headache, you go the traditional health model will say, let's take an Advil, take a Tylenol or Excedrin, give you a medication to mask that symptom, kind of cover that symptom. It really doesn't look at what's causing that symptom. It's like, let's get rid of it. You don't have it anymore. If you need to go to more drastic measures, potentially some more injectables or surgery, things like that. But the big piece is you're not really looking at what that causes, and the problem will worsen with time. What I practice in my office and what I think the tide needs to shift is more into what's called an aligned health model, where we're addressing what is the root cause of causing the headache, right? Is it a cervicogenic headache, meaning that there's a problem in the upper cervical spine that's causing a lot of tension? There's some muscle spasms up there, which can be putting pressure on the nerves, again, causing that tension-based headache. Or is it dehydration? Or is it a brain tumor? Or is it, again, finding that root cause and figuring out what's going on and addressing that root cause is what's really that supportive, aligned health model. There's healing. So when you address the cause, then your body actually heals itself. And there's oftentimes lifestyle modifications leading to what's called actual true health, not just suppressing the symptom. The problems don't worsen because we've addressed them. We've moved through them. So that's kind of what I practice and what I feel like things need to shift as well. But I really want to talk to you guys about why I am here, because I have been where you are today. I dealt with a lot of digestive issues when I was in my 30s, constipation and diarrhea, kind of going back and forth between the two. I dealt with a lot of gluten intolerance, which I never used to have problems, but as I got a little older, I can't seem to eat this gluten anymore. I thought that was more the issue. I was bloated, I was puffy, I was unable to lose weight, I was sleeping terribly, oftentimes waking up at 3, 4 in the morning and not able to fall back to sleep, sometimes 1 or 2 in the morning. I don't know if anybody here has dealt with that, but I thought it was normal after having kids, and after I was stressed and I was, dealing with a lot of stuff. I thought that was just normal. And then 3 years ago, I had a relatively life-changing event where I started having some vision loss. I had a problem. I was unable to see out of my right eye. My peripheral vision, I'd lost it. I started losing the mouse when I was typing my notes and when I was in practice. I'm like, this is something wrong. So I went to see an eye doctor. I actually have really good vision. So I was like, hey, find out what's going on with me. My eye exam was abnormal and the doctor referred me out for an MRI. I then looked up that MRI. I'm going to show you here in a second. I looked it up because I'm a provider for the MRI imaging company. And I was at home. I looked it up and I saw this. That is a giant 6-centimeter lesion that was in my brain. The place where it's located right here is near what's called the optic radiations. And that's why I had the vision loss. There was something that was pushing on my brain and causing my vision loss. So I saw this and I completely freaked out. I read the radiology report. The first thing it says under differential diagnoses, which are kind of like what they think it is, was a malignant neoplasm. So that's a cancerous brain tumor. That's bad, right? They thought it was a form of multiple sclerosis called tumefactive MS. Also not good, right? Neither of those sounded good. I did go see a neurologist. They wanted me to have a biopsy of my brain. I said, no, thank you. Biopsy basically involves a needle going through my skull into my brain, pulling out tissue. I don't want anything to do with that. So I realized at that moment I needed to take my health in my own hands. I was able to find a natural health practitioner that's actually located out of Florida who had seen this before. And I started a program with her office staff, one of her associates, and it completely turned my health around. I'm really happy to say that today I feel amazing. This was 3 years ago. My vision issues are gone. The lesion in my brain has reduced greatly. My digestion has never been better. I had no idea just how terrible I was feeling until it's gone, right? I'll occasionally maybe eat something that maybe doesn't quite agree with me, but I have remedies and things now to handle it. And I eat gluten like crazy. I make sourdough at home. I love it. I just had a sandwich today. But I've never been able to eat these things without problems. Now I feel great. I'm 49. I'll be 50 in April. And I have the best menstrual periods that I've ever had. I'm super regular. I don't have any more cramping. I don't have any bloating. Like I feel relatively great. I sleep through the night and I'm rested most mornings. My life is very different than it was 3.5 years ago. So I knew that, like I said, it was time for me to make a change. And then I also have had the opportunity to now learn how to use these techniques to help my own patients. My friend and my mentor, and now my friend, has taught me what she knows. So I've been able to help a number of patients with their health issues, just like I was helped with mine. So you might be thinking, I have IBS, I have fibromyalgia, I have chronic fatigue, and there's no cure for that. Those are all just a list of symptoms. Those are not actual real they're diagnoses, but there's no cause really listed in those. Those are just names of syndromes. I don't have the energy or the time to dedicate to myself. You might be thinking, I've tried other programs before and they didn't work for me. You might also be thinking that I'm afraid I won't be able to stick to the program or see results. These are all really legitimate things, and we're going to be addressing all of these here. I see so many women and people and women, especially in my practice, who are struggling, and I want them to feel supported and understand that they are cared for during this journey, because that's what it is. It is a journey. So here I'm going to say that you can do this. And what I like to say with my patients and in my practice is that there are 3 keys to success. Number 1 is to be open-minded and coachable. We're going to be talking about things that may be a little different for you. You maybe haven't heard before, or may seem kind of contrary to what you've been taught growing up. I just, like I said, as long as you're open-minded and are willing and interested in trying new things, that's key number 1. Key number 2 is to be focused on the progress, not perfection. This is, like I mentioned in the very beginning, a journey. There's going to be small victories along the way that start to add up. And a couple months later, you're like, oh my God, wow, I feel so different. So focusing on that weekly progress is super important. And lastly, number 3 is never let self-doubt keep you from what you want. Don't get in your own way. It's really easy to do, but trust me, I will help you through this. Maybe you've tried, countless medications, supplements, you name it, and you're still not really feeling any different. Maybe you've tried different diets that are just unattainable and, not going to necessarily be conducive to an average lifestyle. Maybe you've tried seeing multiple practitioners and no one has really been able to pinpoint what's actually going on with you. Like I said, if you try those 3 things before, like I mentioned, like if you're able to be coachable, focus on the progress, and then also not get in your own way, you will be successful. So what I'd like you to do right now is imagine what your life will look like in 6 months. 6 months from now is middle of the summer, July, August. What is it that you're doing? What in your life is missing what is missing from your life, that used to bring you so much joy? What is that one thing that you would like to do that you haven't done for years, or you're afraid to do, or you realize that's not going to be the same? I'd like for you to write that down in the chat, kind of what it is that you're looking forward to in the next 6 months that you haven't been able to do. I'd love to see what that is. Please share it with me. What we're going to do today is talk about how to share. And we're going to share about how to begin that journey to wellness and reclaim that true vitality in your true health again. We're going to take a deep dive into what's actually causing your health challenges and other disease processes and really see kind of what it is that we can do. Our bodies are amazing. Once they're given the proper tools and environment, our bodies can heal on their own. That's kind of the main premise behind chiropractic. This is all the same too. Our bodies are magnificent, and once they're treated properly and given the right ingredients, they can heal. So that can happen for you as well. All right, so what we're going to be focusing on this evening is 3 steps to improving your health. We're going to kind of break down each one of these. We're going to start with eliminate. So working on figuring out what the causes are and kind of eliminating those said causes. We're going to discuss nourishing, how to restore the health and the cells and give them energy and help the body to do what it's supposed to do and properly heal. And number 3 is to thrive, to optimize your health and help make lifestyle changes that are sustainable for you, that will support the changes that you've made so that you can continue to be empowered and be on this journey and be in the driver's seat when it comes to your health. I think that that's the most important piece, is having an active role and an active participation with your health. Like I said, we're not victims to things. We are able to make changes and help to move them. It's never, ever too late. All right, so it's time to stop covering up the symptoms. You're not feeling like yourself anymore, and you desire a solution because you know that you're not right. Your energy is off. Your sleeping is terrible. Your hormones are all over the map. You brain fog, fatigue, your digestion isn't great. All of these things have been affecting you for a long time, and it's time to stop covering the symptoms and figure out what's actually causing them and really deep dive into what's going on and how best to serve your body and help to heal. Oh, next. There we go. All right. So step 1, we're going to talk about eliminate. So here's your quick little 6th grade science lesson again. What I've got here is a photo of your cell, and there's all kinds of different organelles inside the cell. The one we're going to be focusing on the most is the mitochondria. If you remember, the mitochondria is the powerhouse of the cell. Think of it like an engine, and it needs certain nutrients, enzymes, hormones, things in order for it to work properly. It needs proper fuel. Oftentimes what can happen is the surface of our cells or inside our cells can be dirty. There can be wastes in there. There can be things that are having a hard time getting in, hard time getting out. And it's like the engine of a car. If it's dirty, how does it function? It doesn't function very well. So each of the mitochondria, just like I said that there's fuel that comes in, there's also exhaust. So when you go through this energetic process that happens in the mitochondria, there's also exhaust, or there's certain waste products that are kind of stuck in the cell. If those waste products aren't able to get out, again, it doesn't work very well. If the cells are overloaded, they can't function as they're meant to. It's like if a car has a lot of exhaust and it isn't able to get out of the car, well, that's deadly, but it's very, very damaging, and that's not good. So what we do is we focus on what types of causes are potentially causing that mitochondria to not work as well. There's lots of different causes, and here are a number of the ones that we see in our practice. So there can be food sensitivities. We can be bacteria. Let's go with parasites because that's the next one on the list. Parasites. So the parasite issues are way more common than a lot of us think. They're very, very common. They can lead to a lot of different health challenges, even cancer. So dealing with parasitic infections are super, super important. There can be tick-borne reactions, Lyme, other diseases that are transmitted via insects. There's bacteria, there's viruses. You can have an overload of those inside the body. Radiation is another challenge that we can get from a lot of different, your cell towers, from EMFs, you name it. Mold is the next one. We dealt with a mold issue in our home last summer, and actually had been going for a long time. And I was the only one that got sick from it. And once we got it resolved, and I did a number of detoxing for myself, my health challenges improved. I had a huge rash on my arm, which was mold, actually. Toxic chemicals. I mean, there's so many chemicals. We'll talk about that here briefly in a couple seconds. Metals as well. And then stressors, the emotional stressors that we all deal with can be very dangerous and can definitely affect the body in a negative way. So these are all a lot of the causes, and I'm going to show you a quick little research article about eliminating toxins from the body, because that is super, super important. It says the widespread introduction of assorted toxic chemical agents in our intricate biochemical workings has the potential to disrupt sophisticated biochemical processes, aka your energy, becoming a widespread source of harm. Early life exposures can have lifelong consequences at levels commonly experienced to and thought of as safe. So a lot of things where they say, oh, this is safe, but if exposed to as a child and throughout your life, can lead to your body not being very healthy. And we see this all the time with our patients. So I just kind of wanted to point that out as well. What I ask that you guys do is take a look at what you're putting in your body. So the average woman in the United States uses 12 cosmetic products composed of 168 chemical ingredients daily. That's a lot. And our skin is our largest organ. So it has pores, it absorbs chemicals, things that you put on your body come into your body. Also things that we breathe in, you name it. But what I recommend that it's super important is to read labels. So look for things on your cosmetics. And if you're shopping at the main, like at, Costco or the main, stores, Target, Walmart, you name it, a lot of these products will have polyethylene glycol, parabens, phthalates, that's a weird word, aluminum, fluoride, dioxane, oxybenzone, you name it. I always say that if it's really hard to pronounce, it's probably not the best for you. So really looking at using more products that have essential oils, that have natural oils in them, that have shea butter, that have, I use grapeseed oil on my skin. I don't use any chemicals. I don't use lotion. I just buy organic grapeseed oil at Lakeland's, the local co-op here. So look at that. Take a look at that. There's also some good apps you can use. We use Yuka. It's Yuka. It looks like a little carrot icon. It's a free app that you can scan a barcode when you're shopping. It works for food and it works for products as well too. And my kids do it all the time. So if they're like, Mom, I want this thing at Sephora. So then I would scan it. I'm like, oop, it's a number 5. You can't get that. So it kind of gives a 1 out of 100 number. So that's something that if you guys are looking at wanting to do, Yuka is a really cool app. All right, so we're going to talk about our first health insight tonight. So the first one is kind of tying into this eliminate theme, as I recommend drinking water with organic lemon every morning before you have anything else. Basically, it's a great way to get a little bit of vitamin C in the morning. It's great to do, again, before you have coffee or anything, because you're getting some level of hydration, which is awesome. It gives you a potassium boost, helps to prevent kidney stones by adding that much needed acidity kind of into your digestive system, as well as into your urinary system. Lemon is wonderful for you. And it can also aid in digestion as well by giving you that acidity to kind of help with the stomach acid. So if you want to put a little bit of lemon in your water first thing tomorrow morning, that would be awesome. All right, so step number 2 is to nourish. So we really look at, once we address and remove the cause of the issues, it's really now time to replenish and support the body as it heals. How do you eat? With our patients, we talk about food quite a bit. We discuss what they eat, how best to properly fuel the body. Food is important, and teaching how to eat is super important as well too. As a doctor, I love to teach. That's just what's really kind of innate and ingrained for me. I love working with my patients to help coach them on what to eat. I don't put people on diets, but we really look at what people eat and look at ways that we can optimize increasing protein, increasing healthy fats, increasing things that you may not have enough of, decreasing some of the processed foods because of a lot of the chemicals and the kind of the void in the nutritional value. So we do a lot of discussion on feeding your body properly and really helping the body. Supporting and strengthening the body, again, is key. So we discuss, like I mentioned on that last slide, nourishing the body post-detox. We talk about a lot of supplementation, certain foods that add those types of things in. Protein, I find that a majority of people are not getting enough protein, especially early in the day, and that's going to help with your energy. That's going to help with that blood sugar modification and balance that we need. That the high blood pressure, our blood sugar crashes definitely lead to fatigue and chronic health issues as well too. We also talk about replenishing the healing process with healthy fats, probiotics, prebiotics, you name it. Those are super, super important. Nourishing the soul is also essential. The mind and the body are connected. That true holistic way of looking at the body is mind, body, spirit. So making sure that the mind is good, the body is good, the spirit is good. It's all really important. So we discuss a lot of stress reduction techniques, whether it's using meditation, yoga, deep breathing. I have a lot of my patients that prefer to journal. And once they journal, that really helps with their stress levels, helps with their managing that as well too. We also discuss a lot of getting adequate sleep for recovery and energy restoration. That is key. If you're having problems sleeping, that is probably a big thing that you're missing. And that's something we will definitely help to address with you. All right, so health insight number 2 is nourishing your body through breath. So I'm not sure if you guys have seen this before. This is the 5-5-5 breathing practice, or it's also called box breathing. There's a couple different names for it, but it's essentially a way to help reduce stress on the spot. So what you do is you breathe in for a count of 5, You hold that breath for a count of 5 and then breathe out for a count of 5. And what that does is that provides a neurological reset and a quick, effective way to get out of that fight or flight. And if you do it 5 times, you have no choice but to get out of that fight or flight and kind of start into that parasympathetic calming space. So let's take a few minutes here, or not a few minutes. We'll take a couple seconds here and we'll breathe in for 5, okay? Hold for that 5. And breathe out for 5. So if you do that, like I said, 5 times, you're going to go ahead and calm. It's a really good thing to do when you're feeling stressed out, like you want to yell at the kids or something. Like, never do that. But it's a great way to kind of calm the body, calm the brain, calm the neurological system, and it's awesome. All right, so moving into step 3. Step 3 is then to thrive. So once the body has been cleared of the toxic burden, it has been supported with proper nutrition, now it is time for you to thrive. You've supported the mitochondria, those little powerhouses of the cell, you've increased your energy, and you've gone through a journey. Now it's time to really live and really thrive and optimize your health overall. So what does it mean to thrive to you? So to me, thriving means waking up feeling rested and ready for your day, having the energy to make it throughout the day as well. It means being able to work all day long and still have the energy and physical desire to get out and do something with a family member. Thriving to me means feeling comfortable in my clothes again. I'm not needing to put things on just to cover up, to be able to feel comfortable and confident in the clothes that I wear. Thriving also means knowing that digestion is not going to be a problem when I want to go be active with my family. So that is what thriving means to me. Why don't you write down in the chat what thriving means to you? See what that is for you, because everyone's got their own different definitions. So I'd love to hear what yours are. I also want to say that you got this. Learning to manage new changes on your own can be a big deal. Adding new habits, we do it slowly in our practice, is the successful way to make changes. It's not going out and doing 15 things at once. No, it's one thing here, one thing there, one thing there. It's small baby steps in order to really kind of make long, sustainable change so that you can heal. That's just really the main approach that we take. We also make sure that we focus on personalized service and results. There is no one size fits all. There's a lot of programs that I've seen are like, okay, you take this and then you do this and then you do this. It's like, no, I like to find out what's going on with each individual patient, where their concerns are, what they're dealing with, how best we can support them individually and figure out what their solutions are and help to give that to them specifically. The big piece I want you to understand is you're not alone. We're going to walk you through this, and you're never ever on your own. So you always have a hand holding from me. All right, so our last health insight tonight is about thriving. So one thing I recommend, and I do this when it's not freezing cold outside, is go for a walk for 15 to 30 minutes after a meal. So what it does is it helps you to better digest your food. So if you have that big carby lunch and you feel all bloated and fat and happy and you want to take a nap, go for a walk. It's going to help to whenever you eat, the sugar goes into your blood and raises your blood sugar. Then if you are active right away, you actually burn that energy off so it doesn't get absorbed and stored into your cells, and your body doesn't have to release as much insulin. So like I said, it decreases blood sugar and the insulin response. You don't need that insulin to get that out of the blood because you're burning it off with your exercise. It can also lower inflammation in the body, which is super, super important, and aids in weight loss if this is something that you're doing on a daily basis. It also can reduce blood pressure, and blood pressure, they say, is kind of the silent killer. When blood pressure is out of control, and through the roof, the risk of cardiac events or stroke is really high. So going for a brief walk just after eating is a huge thing that you can do for your health. Okay, so we've talked about a ton of stuff in the last 30 minutes here tonight. And I could sit here all day and talk about these things, but I know that time is very limited and I understand. So I want to be very mindful of that. It is important there's so much more that we can talk about, but I think the big piece that I want to share is that I'm a health detective and I will not stop until I find the cause of your concerns. Nothing just happens to you. You didn't just wake up one day and I didn't wake up one day and have that lesion in my brain, right? That took a long time to develop, and there was a cause. The cause for me was actually a parasitic. It was parasites in my brain. That's what I had dealt with. But everything has a cause. So it's my mission to figure out what the cause is for my patients and to help to handle that. So how many of you guys would be interested in addressing your health issues for good? If it's you, and if you're interested in that, write me down in the chat so we can know that you're serious about making some changes, because I would love to help. So what it is that we do is we actually give true solutions for your concerns that are customized and tailored for you. We figure out what the problem is, we figure out a solution, and then actually present that to you and have one-on-one personalized guidance and direction from an experienced practitioner, which is myself. This is not a thing where we have multiple different practitioners. It's just me. So I am the person that you would deal with. I am the person that you would talk with and really help to address that root cause of the concerns and not cover up the symptoms anymore. So what it is that we're offering tonight is an initial Restore Your Vitality consultation. So what we do with that is we share with you a detailed health questionnaire in which you fill out kind of what's going on with you, a lot of the symptoms that you have. We have with something that's called a symptom survey form, which gives you a number, and we actually use that number in subsequent visits, and it's really great to kind of track and see how the process is going. We have an in-depth 30-minute one-on-one history and consultation call. If you're local, you can come into the office, of course. We can also do a lot of this stuff online via Zoom or via the phone, so we can figure out exactly what's going on, find out what your desires and your dreams are and your focuses are, and really look at how best to support you. We would then take that information and I would then do what's called a quantum nutrition testing assessment and then use that data to help figure out what's going on with you. I can share the process with you at another time, but it is super great to figure out kind of what's going on. It's a wonderful tool that I've been trained to do to help to support my patients. And lastly, what's included in this consultation is what's called a report of findings. It's a customized plan and presentation for you to saying, okay, this is what's going on. This is what's going to help you. This is what it would take. And that would all be included in this Restore Your Vitality consultation. In addition, if you decided that you wanted to move forward with something like this, I'm going to offer or give you a free 7-day meal plan with recipes and a shopping list. So I don't know about you, but coming up with meals every day is hard. I find it very challenging. So if someone just went ahead and emailed me a 7-day meal plan with all the things, I would be like, thank you. So that is something that we're going to be giving you tonight as well, $49 value. And then the second, number 2, is the 7-day sleep improvement plan. So a step-by-step guide to help improve your sleep environment and routines and overall quality, because that is so important to helping your body to heal. I'm going to go ahead and send that to you as well. Come on. There we go. All right. So next thing I'm going to do is I'm going to share a video with one of my patients. Her name is Candace. Unfortunately, Canva doesn't like to talk to video and talk to the webinar platform. So I'm going to have to stop sharing my screen here, and I'm going to jump on. Sorry, give me one quick second here and show Candace's video. There we go.
What is it that brought you into our office for quantum nutrition testing?
Yeah, I wanted to see Dr. Adrienne for several different things, one of which is perimenopause symptoms, sleep issues, kind of just feeling like overall puffy and not feeling great, just not feeling my best. Something was off, not quite sure what.
Sure. And what was your experience been like?
So I just finished the 6-month program and I am super excited, super happy. I think I have a lot of different things that came from it. My scores have significantly went down from March when we started. I'm sleeping better. I'm, not feeling as puffy. I'm feeling the brain fog was another thing that really has subsided. And just, I think the biggest thing is really being in tune with my body of what is going on, that I never really had that mind-body connection before. I kind of did, but was more on the Western medicine side of things, of just taking a Tylenol or taking an ibuprofen or taking something over the counter and not really thinking through a lot of those things. So I think that was a big takeaway for me too.
Awesome. Thank you so much for sharing your experience.
Yes.
I'm so proud of you. You've done a fantastic job.
Thank you.
Thank you.
All right, let's get back to my presentation. All right. So yeah, Candace is amazing. So kind of taking a quote from what she'd said, that she's sleeping better, she's not feeling as puffy, that brain fog was another thing that has subsided, and that she's now in tune with her body, which is huge. That's kind of the beginning I was talking about, like being your own advocate, being able to understand what you're feeling in your body is super, super important. So you can say, wow, this isn't right. So that's a huge, huge piece. And she's made amazing progress, and so happy to share that with you guys. Okay. So what I mentioned before was that Restore Your Vitality consultation. So broken down here is the extreme value that we're going to give you tonight. So I'm going to be offering you an in-depth 30-minute one-on-one history and consultation with me. We're going to go through all of the information, have that quantum nutrition assessment done as well, and then the customized report of findings call in our office. If you were to come in and do that on a regular day, it would be $328 value. Tonight, we're going to give you a significant discount for being a member, being on this call today. And even those that are watching this on the replay, this will also be in effect for a few days. So don't worry. Also, I'm going to include the 7-day meal plan and the shopping list, like I mentioned. That's another $49 value, and including that 7-day sleep improvement plan as well. We'll get that emailed to you right away. A total investment, a regular investment of $426. I can help you get your health back on track for only $97. So like I mentioned, huge, huge savings, because like I said, you guys are taking the time to be here tonight. I'm going to offer this to you guys, and I would love the opportunity to connect with you and talk about what is going on and help you to find some solutions to your concerns. So Larissa's dropped that link in the chat there, so you guys can go ahead and click on that if you want to move forward. I highly recommend that you do that. This is really simple to get started. So we're going to schedule your initial one-on-one consultation. I think initially there's a pay link in there to get it handled, and then you can go right into my scheduling software. I'm going to show you a little window on how to do that here shortly. Complete that health questionnaire once you get it in your inbox. Attend the consultation, uncover underlying issues that are the cause of your concerns, and then we're going to give you a customized solution for you to help you to achieve those desired results. Kind of that desire that you put in the beginning of the chat, that's something we're going to work towards for you. So now you have a chance to make, or I'm sorry, you have a choice to make. Are you going to continue kind of following down the traditional health model that has yielded minimal results and not necessarily giving you what it is that you need, and not really kind of getting into that true health like we discussed? Or are you going to turn left and kind of follow that aligned health model, try something different that's going to actually look at what's going on, find that cause, address that cause, and really bring that true healing piece in. And for only $97, that's something that we can offer you guys tonight. So I hope that that is something that you move forward with, is really kind of leaning into that aligned health model and letting the traditional model kind of do what they're really good at, which is acute stuff, orthopedic surgery, you name it. When it comes to long-term disease care, the traditional health model doesn't really help as much. All right, so a couple screenshots of what you're going to see. If you guys have clicked on that link, you're going to see this scheduling piece in order to kind of get that Restore Vitality consultation. First thing you'll do is put your name and information in here. It's pretty quick and easy. You want to do the drop-down menu. You're going to see that Restore Your Vitality consult. That is the one that's got that special offer for this evening. Just click on that. Then it's going to open up my scheduler and let you know which days and times are most convenient for you. So you can pick and choose which one it is that works for your schedule. It will be then, like I said, with me. So it'll be a phone call with me or a Zoom call with me, or in office, like I mentioned, and we will get that taken care of for you. And lastly, there it is. You've scheduled your appointment. You have made the first awesome steps towards regaining your health again. So super, super simple. All right, I just want to share another testimonial from a patient of mine named April. She said, after completing phase 1 of the nutrition testing program, I have noticed some great changes in my overall health. I was suffering from frequent diarrhea, and that is completely resolved. I have less bloating, which is great. Also, my anxiety and stress seem to be under control. The process of testing is very interesting, and it uncovers more than you would expect. It was a fun experience. All right, so now is the time to make a change. And maybe it isn't for you. Maybe there's a lot going on. Maybe you've been dealing with stuff and you're like, oh, whatever, it's fine. It does require some effort. Maybe you're not ready. But here's my question for you. If not now, then when? When is a good time to start making these changes? I've had so many patients that have said to me, I wish I would have known about this before I had my gallbladder removed, or I wish I would have known about this before I started on hormone replacement therapy or on thyroid hormones, because once you're on those, it's really hard to get off of them because the body stops doing its own thing once you start adding artificial things in there. So if not now, when? When is a better time to start moving forward with your health? And also, how much is your health worth? This investment of $97 is nothing compared to the amount that you have paid in expensive lab tests, in ER visits, or scans. What about the cost for medications or the intangible costs of lost work, lost time with your family? You can't put a price tag on that stuff. At this rate, I can assure you your symptoms will not improve without making any sort of changes, and oftentimes they're going to get worse. Cancer, like any other chronic disease, takes decades to show up and to be detectable. But they've been going on for a long time, and your body gives clues in these symptoms that something's wrong. So listening to these symptoms and addressing them is super important. So that's just kind of what I recommend, because what have you got to lose? Action is the only thing that's going to bring you towards that brighter future and towards your goals that you have. Sorry, hang on. My throat's super dry. What is it that awaits you on the other side? Now is the time to take that action that's needed in order to really start moving your health in a different direction and really kind of get off that path of disease or of symptoms. Excuse me. I think it's really important to look at kind of what is on that other side. What is it that you desired, that you put down in the beginning? How do we get there? And I'm going to give you a solution here. What would your life be like if you did not have these challenges? You're finally feeling like yourself again. You're clear thinking. You feel on top of your game again. You have the energy to be active and feel comfortable in your body again. We can help you to find you again. So this is a picture of myself, my husband, and our 2 daughters. And we went on an amazing vacation last year to Costa Rica. And this is halfway through this amazing 5-kilometer hike, kind of down into the depths of all this amazingness. And I would not have been able to do this when I was feeling like crap. I didn't have the energy. I would have been like, where's the bathroom? Because I'm going to need to know where that is. I would never have been able to do this amazing experience feeling the way that I did. And also, it was these people, these 3 amazing humans that I love so much, that I thought of the day that I saw that lesion in my brain. I thought, who's going to be there for my kids? Who's going to be there for my husband if something happened to me? It was huge. It was very humbling and very sobering. And I knew, like I said, I needed to make changes that day. Who is it that you need to show up for? Who is in your life that is suffering because you're not yourself, because you're not able to care for them the way that you know that you can? You are that important. So it's really important to just kind of look at who else is there for you, because they need you. Everybody does. Okay. Whew. Last thing I want to talk about here before we end our awesome experience is kind of some quick FAQs that a lot of people like to ask me. First of all is, does my insurance cover this evaluation? Unfortunately, it doesn't. Insurance is a very traditional health model type tool. It covers a lot of some certain tests, and I mean, there's deductibles and you name it. Insurance doesn't doesn't cover costs of figuring out what's actually going on and dealing with these kinds of things. So unfortunately, it doesn't. A lot of our patients do use HSA plans or health savings accounts or flex spending accounts for services in our office, and so those are absolutely covered as well. How do I know that it will work? Every single person that I have worked with over the last 3 years has had some positive experience, positive thing that has helped them, definitely some positive changes. It really depends on you. It depends on your level of commitment. And I mean, as long as you're in, you will definitely have some positive changes for sure. And lastly, how will I find the necessary energy or to make the necessary changes to improve? Like I said in the beginning, we take baby steps. I love to give my patients kind of different tools or different things to do per week. Sometimes we have to stick the same thing a couple of weeks in a row because it's a lot of change. And so we tread very lightly. We go very, very slowly just to make sure that you're able to move forward. And if you're not, then that's okay. We handhold and help you out throughout that process. small changes weekly do equate to big rewards. All right, so limited time only, so don't wait to start your journey back to health. I only take a handful of spots these each month, so I've got only 5 spots available for you guys, and we're holding this link open for the next 72 hours, so we've got 3 days. But if you want to get in on this, I highly recommend that you move forward, because I would love to help you guys, and I would love to walk you through this journey as well. All right, so overall, I want to say thank you so much for your time tonight, for being here. I appreciate all the things. I know that it has been a big, it's a big time commitment to be here, but I really love I look forward to working with you guys and talking with you guys and answering whatever questions that you guys have. All right, I'm going to turn off my screen share. It's going to be back to me. Just kind of, you guys have a lot of really cool questions in here. I know improving digestion, vitality to keep up with energy, like all of these things sound so familiar. I completely understand. Energy, weight loss, to be happy. No, Joseph, it's not for women only. Men absolutely are. I have a number of male patients. I've got one in particular who's had Crohn's and had a lot of major digestive issues. And he's been with me for, over 2 years now. And he's no longer dealing with any more of these issues. He's moved out of state. We do all of our visits virtually, and he is living an amazing life and no longer has any of these issues. His doctors wanted to get him on steroids, and he was like, no, thank you. I'm going to try this other route. So yes, I do work with men as well too. So big thing. Thriving versus surviving. I completely understand that, Sherry. That is exactly what we need to do. Is surviving is very stressful. And so thriving is huge. So yeah. I love all your guys' comments. I know Larissa has put this consult link in the chat a couple of times. So if you have not had the opportunity to do that, I really hope that you do that for us as well. Sherry, absolutely. I will reach out to you and look and see if that got booked. All right. Joseph would love to work with you. Absolutely. Yeah, you know what, guys, I want to say thank you so much for being here tonight. I really appreciated you being here, and I hope that you guys have a wonderful, wonderful evening. If you have any other questions, please feel free to reach out to us into our office, or like I said, book that consultation, and we'll be able to have a great conversation with you. All right, I hope everyone has a wonderful evening.